Hello and welcome back. Today I want us to discuss a very important topic on abnormal uterine bleeding. So, have you ever experienced prolonged irregular menstruation? Have you ever passed during your menses clots? Okay. Or even have you ever had episodes or times where you bleed in between your periods? So basically, your periods are very regular, and before even you get to your next periods, you actually bleed in between. Or probably sometimes you feel just fatigued every now and then after bleeding, or just dizzy. Okay. Or have you ever felt some pain when around the pelvic region? Okay. Or probably you have experienced some form of infertility. You've tried to get pregnant, but you have not been able to. Okay. You probably might be suffering from what we call abnormal uterine bleeding. So, so that is the topic that I want us to discuss today. But before we dive into abnormal uterine bleeding, I want us to listen to some words of wisdom from the book of Psalms, chapter 119, verse 105. And the Bible says, "Thy word is a lamp unto my feet and a light unto my path." So, what is abnormal uterine bleeding? So this basically refers to any form of bleeding, okay, from the uterus that is abnormal in terms of volume, in terms of the regularity, so it is irregular, in terms of the frequency and the duration of bleeding. Okay, and basically this one should occur in the absence of pregnancy. So if you are pregnant and there's any kind of bleeding, probably it might not be quote unquote abnormal, but it could be as a result of something else. So you're not pregnant, but then the bleeding is too much. Okay, it is irregular, and then the frequency is too much, or very frequency is prolonged, and then the duration is also prolonged. So that one might be the best description for abnormal uterine bleeding. So abnormal uterine bleeding in itself is supposed to be a symptom of an underlying condition, and not per se it as a diagnosis. Okay. So, the normal uterine bleeding is supposed to be cyclic. So, cyclic means it's supposed to be like at least the normal menstrual. We talked about it. It's supposed to be from 21 to around 35 days. Okay. And then the duration is supposed to be taken from 3 days all the way to around 8 to 9 days, depending on. There are people who bleed only for 3 days. There are people who bleed all the way up to 7, 8, 9 days. The volume is supposed to be around 10 mils to around 18, 90 mils thereabout. Okay, and then regularity is probably from 7 to 9 days between cycles, and then any deviation from this, okay, then we will term that one as abnormal uterine bleeding. Okay, so we can describe abnormal uterine bleeding by the pattern which it comes. So number one, you can have menorrhagia. So menorrhagia is basically heavy menstrual bleeding. So when you talk about heavy menstrual bleeding, you're talking about bleeding that is more than 80 mils. Okay, you say that the normal is from 10 to around 80 thereabout. Okay, so you are bleeding too much. Okay, so more than 80 mils. Most of the time we will gauge it with the number of pads that you change. Okay, so if you change more than 4 pads in a day that are heavily soaked, that shows that you are actually bleeding too much. So that one is menorrhagia. And then the other term that we use to describe abnormal uterine bleeding is metrorrhagia. So metrorrhagia is basically the irregular menstrual flow. Okay, so your flow is so irregular. This day you're getting it at 21 days, the other day you're getting it at 18, the other day you're getting it at 35. So it is irregular menstrual flow, irregular uterine bleeding. And then the other term is menometrorrhagia. So with menometrorrhagia, it's a prolonged, irregular, so it's a combination of menorrhagia and metrorrhagia. So it's prolonged, and then it is irregular, heavy bleeding. So prolonged, irregular, heavy bleeding. And then the other term we use also is polymenorrhagia, which is the cyclic bleeding, but that is more frequent, less than 21 days. So we say the normal one is 21 to 35, but this one is less than 21 days. And then oligomenorrhagia is when the frequency increase more than 35 days. So your menses come more than after 35 days. And then amenorrhea is where you don't get your menses completely. And then we have intermenstrual bleeding. So you have your normal menses, but then in between you have episodes of bleeding. And then you have postcoital bleeding, which is basically bleeding after sexual contact. And then the last one is postmenopausal bleeding, which is basically bleeding during your menopause. Okay, so during menopause you're not supposed to have any form of bleeding, but then when you start bleeding during menopause, it is an abnormal uterine bleeding, and we are going to look at what could be the main cause of such kind of a bleeding. So what are the major causes of abnormal uterine bleeding? Number one is polyps. So polyps are abnormal growths in the uterus. Okay, you can have like so this basically will be uterine polyp. So you can have something like nasal polyp. Okay, you can have something like anal polyp. Okay, so polyp is an abnormal growth on the mucosa or on the lining or on the skin of the lining of the uterus. So you can have a uterine polyp. So a uterine polyp is one of those causes of abnormal uterine bleeding. And then the other cause is adenomyosis. So adenomyosis is presence of, you see, the uterus has three layers. So it has the endometrium, which is the innermost layer that basically has a functional layer, which is the one that sheds off during your menses. Now, that functional layer which sheds off during your menses, okay, it's supposed to just be found on the endometrium. But then if you find that kind of a tissue, okay, in either the myometrium, which is the second layer of, or the muscles of the uterus, or even outside at the perimetrium, now that is called adenomyosis. So presence of functional endometrial tissue outside the endometrium. Okay, so that one can actually cause a lot of bleeding, mostly on the myometrium. Okay, and then the other thing that causes abnormal uterine bleeding is leiomyoma. Leiomyoma basically in simple terms are fibroids. Okay, and especially what we call the submucosal fibroids. And then the other thing that can cause abnormal uterine bleeding is malignancies, okay, or hyperplasia of the endometrium. So hyperplasia is basically inflammation and or increase in volume and bulkiness of the endometrium. Okay, so malignancy could be anything like endometrial malignancy. It could be cervical malignancy, what we call like cervical cancer, and all that can actually cause abnormal uterine bleeding. The other causes that can also cause abnormal uterine bleeding is when you have some coagulopathy. So your blood is not able to clot well. Okay, once you get cut, okay, and you start bleeding, you bleed a lot, and you don't have the capacity to be able to clot. Okay, so that one it's not only in the uterus, it can actually bleed anywhere else. Okay, so you get a cut, either you're doing your exercise and you get a cut, you bleed a lot. Okay, and then you have other things like ovulatory dysfunctions. Okay, so ovulatory dysfunctions, mostly these are disruption of the hormonal profile of a woman. So basically you end up having more of hormonal imbalances that can cause actually abnormal uterine bleeding. And the things that can cause imbalances of hormones, including number one is when you have polycystic ovarian syndrome. Now we are going to do a separate video on polycystic ovarian syndrome, okay, but that one is one of the conditions that can cause abnormalities in terms of your hormonal profile. Number two is thyroid disorder. So when you have issues with your thyroid, okay, it disrupts your normal hormonal profile, and therefore you can have hyper or abnormal bleeding. And then the other condition is hyperprolactinemia, okay, and then also perimenopausal condition. So basically, your hormones become so much imbalanced, and therefore you will end up with abnormal bleeding. The other thing that can cause abnormal bleeding is when you have issues with the endometrium. Like for example, when you have an infection, so an infection in the endometrium, and we talked something like endometritis, okay. Or for people who are pregnant, something that affect, but basically endometritis is one of the major cause of abnormal uterine bleeding. And then the other thing is what we call iatrogenic causes. So iatrogenic causes could mean you are using something like some form of family planning that basically ends up disrupting your hormones, okay? Or you're using drugs that help to your blood not to clot, what we call anticoagulant. You are diagnosed probably with a deep venous thrombosis, or you are diagnosed with a heart problem and the doctor prescribes something to help your blood not to clot, okay? So it can actually as well contribute to abnormal uterine bleeding. Another thing is some other drugs that basically can also cause that. And then there are others that are what we call idiopathic, where even after all the type of investigation, you still do not know exactly what causes that kind of bleeding. Now, if this abnormal uterine bleeding happens during the adolescent time, probably the most common cause will be anovulatory cycles or even coagulation disorders. Now, if this bleeding takes place during your reproductive age, mostly it could either be pregnancy related, so you need to rule out pregnancy. It could be this condition we talked about, polycystic ovarian syndrome, okay? It could be fibroids or called the leiomyomas, it could be infections, or it could even be use of contraceptives. Now, if this bleeding, abnormal uterine bleeding, takes place in your perimenopausal stage, okay, it could mean it could be anovulatory, and we're going to discuss more about that, or endometrial hyperplasia. So endometrial hyperplasia, we say that it is increase in thickness of the endometrium, or even malignancies, or what we call carcinomas, cancers, okay. And then postmenopausal, it could be endometrial carcinomas, okay, polyps, and so those are the major causes. Now, what are the risk factors? Number one is people who are obese. Okay, if you are obese, you are at risk. People who have polycystic ovarian syndrome, people who are diabetic, people who are hypertensive, people who have thyroid function dysfunction. So talked about thyroid hyperthyroidism. Okay, people who have coagulopathies, your ability to clot is not good. Okay, or family history of endometrial cancer can actually be also one of the causes of heavy bleeding. So we have already looked at how patients will present. They will have prolonged and heavy irregular menstruation. They will be able to pass a lot of clots, okay? And the bleeding might be as well in between their periods. And when you have bled a lot, sometimes because of loss of blood, you become anemic. So then they can actually present with general body weakness, dizziness, fatigue, okay? Yes, and then they can sometimes present with pelvic pain, okay? And then as well as some of them present with infertility. They are not able to give birth, okay, or they are not able to get pregnant, okay. So when you come to the hospital, of course, we'll take a good history, we'll do physical examination, and we'll also take some tests to be able to ascertain exactly what is happening, okay. So of course, during the history and physical examination, we'll be able to check whether you are anemic. We're also going to do abdominal examination to see if there is any abnormal mass in the uterus, okay. But also you're going to do a speculum exam to look around the cervix to see if there is any abnormal mass. Are there any polyps, okay? And then we're also going to do some investigation. Some of the investigations, number one is we need to rule out whether you are pregnant or not, okay? And then we're also going to do a complete blood count. So the complete blood count will be able to help us to rule out infections, but also it will help us to be able to know the amount of blood that you have in your system. And then coagulation profile. We say that coagulopathy is one of the major causes of premenstrual bleeding. So you're going to do a coagulation profile to ensure that your bleeding capacity is good, and then thyroid functions as well, and also hormonal profile. We said hormonal imbalance is one of the major causes. And then some of the images that we are going to do as well is a transvaginal ultrasound to be able to ascertain whether there is any polyps in the uterus, any fibroids, okay, or endometrial thickening and all that, okay. But also there are other tests that can be done, as something like saline infusions or hysterography, okay. But also we can do actually an MRI, okay, or even a CT scan, depending on the complexity of the masses that we can find either in the uterus or around the cervical region. Now, the other test that needs to be done is endometrial biopsy, especially if you find the endometrium is thickened, what we call hyperplasia of the endometrium, we need to take a biopsy. If we find that there is abnormal mass around the cervix, okay, we need to take a biopsy so that we can also rule out cervical cancer. And then there is also another test called hysteroscopy. So basically introducing a camera through the cervix all the way to the uterus to be able to look at how the uterus is, okay? Yes. So those are some of the tests that basically will be done. Okay. Now when it comes to management, of course, number one, you need to be stabilized. Okay. So if you have bled a lot, you need to be given some IV fluids. You need to be given, if you are too anemic, you need to be given blood. Okay. Pain medication to be able to help reduce the pain. Okay. And also tranexamic acid plays a very important role in terms of trying to reduce the bleeding. And then of course you need to, if there is hormonal imbalance, then there is need for hormonal therapy, okay, to be able to help balance your hormones, okay. But then the other surgical management, especially if we have found a mass like a fibroid, okay. So for fibroids or what we call myomas, you will need to do what we call myomectomy, or you go ahead and remove the fibroids. Okay, if we find a polyp, then we have to do what we call polypectomy. So we go ahead and cut the polyp. Now, if you have attained your desired family, we can actually go ahead and do what we call hysterectomy. So hysterectomy is basically going ahead and remove the whole of that uterus. Because if you have attained your family size and you really don't need the uterus anymore, we can go ahead and remove it. And then we can also do endometrial ablation, whereby we go and burn those bleeding blood vessels in your uterus. So by far, those are the major the things that you need to know about abnormal uterine bleeding, and some of the complications. If you bleed a lot, of course, you will become anemic. Okay, there will be reduced lifestyle because of the fatigue, but also it can cause infertility. Okay, that abnormal uterine bleeding as a result of probably hormonal imbalance. Okay, but also it can just be the sign of a malignancy. So anytime you have an abnormal bleeding, uterine bleeding, okay, of course for you, you'll never know that it is the uterus that has an issue, but basically when you have abnormal vaginal bleeding, you need to get assessed as fast as possible so that you're able to know exactly what is happening. So if this lesson today has been very helpful to you, please consider subscribing to our YouTube channel, that is Doctor on Wheels. You can also follow us on our social media platforms, on TikTok at Dr. Itsuma, and then on our social media platform at Zawadi Premier Hospital _Ngong, and Zawadi Premier Hospital for our Facebook page. You can also visit us at our hospital. We are located at Lupsil Center, that is at VET, opposite Juampo Petrol Station. Until next time, God bless.